Hey guys, this is Preeti and you're watching my dissolution. I'm back with the other important topic for the university exam, that is glaucoma. Glaucoma, what is glaucoma? Glaucoma is nothing but a damage of the optic nerve. Optic nerve, which is a cranial nerve number 2. There is a damage to that nerve. Whether there may be increase in the intraocular pressure or maybe like an intraocular pressure may be normal. But there is a usually this should be associated. The damage to the optic nerve must associated maybe increase or normal intraocular pressure. Intraocular, the aqueous humor is formed by the ciliary process. See this ciliary process, from where ciliary process, how do it produce? Means this is nothing but the ultrafiltration of the blood. That is nothing but the aqueous humor. Aqueous humor is formed by the ciliary process and drained into the meshwork, trabecular meshwork. Trabecular meshwork. You can see this is a ciliary body, ciliary process. Here aqueous humor is formed. This is a cornea. This is a anterior compartment. Behind the lens there will be posterior compartment, then anterior compartment, again it will be having two chambers, anterior chamber in front of the iris and posterior chamber behind the iris. After the formation of this aqueous humor, this goes and then it will be present in both anterior chamber and posterior chamber. Then it is drained back into the trabecular meshwork, and this angle in between the this thing will be uroscleral outflow. Outflow, there will be two outflow, trabecular outflow and uroscleral outflow. 90% of these aqueous humor is drained into the trabecular outflow, whereas 10% is drained into the uroscleral outflow. The angle between iris and cornea is known iridocorneal angle. Iridocorneal angle. Iris and the cornea, this angle is iridocorneal angle. Here the drainage will be there. In open angle glaucoma, this angle will be normal, but there is a problem in the drainage. When a close angle glaucoma, this iris comes close to the cornea, there will be problem with this angle, so the drainage will be affected. So there will be increase in the aqueous humor in the anterior and posterior chamber. There won't be any sufficient drainage, so increase in the intraocular pressure. That aqueous fluids flow and exert pressure on this cornea. No, there will be increased intraocular pressure. So there will be that is a basis behind this open angle and closed angle glaucoma. Glaucoma, there will be optic nerve damage. Loss of visual function that frequently associate with a raised, mostly it will be raised intraocular pressure, but it's not compulsory that there should be raised intraocular pressure. Normal intraocular pressure is 10 to 20 mm of Hg. Management of this disorder is almost directed by lowering the raising intraocular pressure. So if there is a raise in intraocular pressure, the pressure is exerted on the optic nerve also. There will be optic nerve damage also. So we have to decrease the intraocular pressure by either improving the drainage or decreasing the formation of the aqueous humor. We have to prevent the formation of aqueous humor, or we have to drain this aqueous humor into the trabecular meshwork or uroscleral outflow. We have to increase. This is the mechanism how glaucoma is formed, and what are the treatment how we have to treat. The basis we have to treat, synthesis we have to decrease or increase the drainage of this thing. There are two types of glaucoma: acute congestive glaucoma and chronic simple glaucoma. I'll say the word itself says acute means it occurs suddenly it occurs, and congestive from birth it is present, glaucoma. Acute congestive glaucoma, this usually precipitated by mydriatics. Whenever we give mydriatics which dilate the pupil, there will be dilation of this pupil. For dilation of this pupil, there will be contraction of the iris muscle, so there will be dilation, contraction, so it obstructs the flow, drainage obstructs which obstructs this thing by narrowing the iridocorneal angle. This is iris, this is cornea, iridocorneal angle. Whenever we give mydriatics, this contracts in order to dilate the pupil, iris is contracted, so this obstructs the iridocorneal angle. So which shallows the anterior chamber. There is a sudden increase in the intraocular pressure. Sudden onset of symptoms like severe headache, because eyes also, this optic nerve goes into the brain. There will be pain around the eyes and the redness, blurred vision, halos around the light, nausea, vomiting. These are the symptoms we can see in the acute congestive glaucoma. Acute congestive glaucoma is a medical emergency. We have to acute it right because suddenly no, so we have to treat it is a case of emergency. Suddenly, if it is a prolonged duration, there will be short pain, like pain will be gradually increasing, but it is a suddenly occurring. No, we have to treat immediately. If untreated, this leads to the blindness. If you don't treat, that leads to blindness. Once the attack is controlled, then the treatment will be surgical or laser by increasing the angle. We have to increase the angle, radiocorneal angle, so that the drainage will be proper. This is about the acute congestive glaucoma. Now, chronic simple glaucoma. Chronic means it gradually there will be development of glaucoma. Why this glaucoma occurs? This is genetically predisposed. Genetically, maybe their parents might be having, and then they also got. There is a gene defect in genetically predisposed. There will be gene defect condition affecting the patency of the trabecular meshwork. Trabecular meshwork was draining 90% of the aqueous humor. There will be problem in the trabecular meshwork, so intraocular pressure raises gradually. The progressive loss of the peripheral vision. This is the field of vision you are seeing, means there will be decrease in the field of the vision. Finally you will become blind. The intraocular pressure gradually rises. There is a progressive loss of the peripheral vision, followed by the central field vision also loss. Gonioscopy shows there is a wide angle will be wide and open only. Still there is a problem in the drainage, that is trabecular meshwork problem. So pharmacotherapy is a definitive treatment for this case. We have to give the drugs in order to increase the trabecular meshwork drainage. The drugs which are used for the glaucoma will be prostaglandin analogs. Prostaglandin analogs, what it does means it increases the urociliary outflow. Urociliary outflow, usually 10% was there. That will be increased by prostaglandins. Prostaglandin, the name here also ends prost, Latino prost, improves the urociliary outflow. So the angle will be normal. So it is used in a wide angle glaucoma. This is a drug of choice, and in case of normal angle also it may be used, I guess. And then beta blockers, you know, it ends in a lol and mostly olol. So timolol, betaxolol, cartiolol. These are the beta blockers which are used in the glaucoma. How it acts means beta blockers. It blocks the beta 2 receptors in the ciliary process. So there will be decrease in the synthesis of the aqueous humor from the ciliary process. So there will be decrease in the intraocular pressure. So it can treat the wide angle glaucoma. Wide angle glaucoma, so there is a open angle only, the drainage problem. So we are decreasing the synthesis of this thing, and narrow angle glaucoma, all angle glaucoma we are using. And alpha adrenergic agonist means it improves the alpha action, alpha pharmacological action. Aprachloride, bimonidine, diviprin, anything, however, how much you can remember. It stimulates the alpha 2 receptors on the ciliary epithelium, which decreases the formation of the aqueous humor. It has two effects. It decreases formation also, and it increases urociliary outflow also. So it is used in the wide angle glaucoma. Wide angle glaucoma synthesis is decreased and drainage is increased. So there is there we can treat. And we are using miotics. You know, the mydriatics also causes, there is a narrowing of the anterior chamber. So we are using miotics, example pilocarmine, which improves the trabecular meshwork flow. There is angle will be improved, like trabecular meshwork flow also increased, because there is a relaxation of the constriction of the pupil by relaxation of the iris muscle. It improves the trabecular meshwork outflow. So wide angle glaucoma or narrow angle glaucoma. Osmotic agents. I told no, like this aqueous humor is secreted from the ciliary process, but it is nothing but the ultrafiltration of the blood. So osmotic agents, example mannitol and glycerol are used. Osmotic effect, it shows the draw of the fluid from the eye to the blood vessels is increased. There will be osmotic difference. So the blood, like a fluid from the aqueous humor goes back to the blood way from where it is coming. There will be decrease in intraocular pressure used in a narrow angle glaucoma. and carbonic anhydrous inhibit. Carbonic anhydrous like acetazolamide and dorazolamide, brinzozolamide. This decreases the formation of bicarbonate, so decreases the aqueous humor formation. Bicarbonate is required so that the filtrate of the blood comes into the anterior chamber and forms aqueous humor. So there will be decrease in this. So it is used in a wide angle glaucoma or open angle glaucoma. Example, acetazolamide. This is all about the glaucoma. If you like, I discussed about the definition and what is the mechanism behind like treating this acute glaucoma and chronic chronic simple glaucoma and acute congestive glaucoma. The diagram I discussed, and what is the cause and normal intraocular pressure I told, what is the cause for glaucoma and the treatment for glaucoma. All this I discussed in this video. If you find this video helpful, please do like, share and share to my channel so that you get more videos like this. Thank you.